For weeks here at 10, we've highlighted prescription drug abuse, the addictive nature of narcotic painkillers.
Yeah, there are many people truly in pain, though. They need high doses just to live comfortably.
But did you know those drugs can actually cause pain? KETV News Watch 7's Julie Cornell has one man's story of triumph over his pain and addiction.
So this is going to highlight the nerve. You're going to feel a pinch here. 1, 2, 3, pinch.
Tyler Smith has a 4-inch needle in his spine, and he's awake.
I mean, I still got my shoes on. I mean, I can just get up and walk.
He's having an outpatient procedure through Nebraska Medicine's pain medicine clinic.
So now what I'm trying to do is I'm going to try and touch the bone.
Dr. Thomas Brooks is leading the pain treatment plan, getting to the source of Tyler's pain, not masking it with drugs.
And I'm in. You may feel a little zing.
Brooks is a pain medicine specialist who refuses to prescribe narcotic painkillers to his patients because of their addictive nature.
It's a problem. And once that process is started, it's very difficult to reverse.
It's a novel approach in a culture that has a pill for everything.
You have to go in and convince the patient that you're going to treat the underlying pain problem, and there has to be a certain buy-in that, okay, we're going to do this, but at the same time, we're going to work on reducing your opiate medications.
Opiates that Brooks says are highly addictive and mind-numbing. Drugs created for cancer patients who are dying. Tyler says he was hooked on the painkiller methadone for more than 10 years.
It's bad to say, but we would joke around. It's like, well, yeah, I got to go. I got an appointment with my drug dealer. I got to go. But I was a legal drug addict. You know, I really was.
They were drugs prescribed by countless doctors, keeping Tyler in a haze.
Looking back, you don't remember a lot of the moments, the little moments that always mean a lot, and that's crushing.
Missing his son's childhood, checking out of his own life.
I lost 10, 12 years of my life that I can't even think of now. Gosh, I would go days without sleep. And it was the methadone. It wouldn't let me sleep. It wouldn't let me rest.
Dr. Brooks says the doses were so high, the medicine was actually creating Tyler's pain.
Your body gets tolerant to a certain degree. But also, at higher doses, pain medications have a paradoxical effect. They no longer eliminate pain, but in fact cause pain.
Tyler says he was on a path to early death.
Like I was admitted into the ICU because I was uncontrollable. I was screaming. It hurt, and they just kept pumping medicine into me. And I said, I want off this stuff. I want gone with it.
Within 35 days, Tyler weaned himself off the drugs. Dr. Brooks went to work with anti-inflammatories, numbing medicine, steroids, and nerve blocks.
You see it following the nerve?
Finding the source of Tyler's low back, hip, and leg pain.
He has 2 joint issues and 1 nerve issue.
Brooks doesn't promise patients they'll be pain-free. He tells them the pain will be reduced.
And I'm all done. Needles out. Yes, you will have pain. But more importantly, you're going to wake up. You're going to get your life back.
That promise kept.
Oh my gosh, I feel lighter. I even feel healthier.
Breaking the cycle of addiction, hanging out with his grandson again. Tyler losing 40 pounds. He's sleeping for the first time in years and waking up to a fresh start.
Just because your life is set in that groove, it doesn't have to stay that way.
Julie Cornell, KETV, Newswatch 7.
Dr. Brooks says results depend on many factors, but he said there's also something else they can do to lessen the pain and create comfort.
Yeah, Tyler had a stimulator device implanted, which he says generally greatly reduces his back pain.
And if you want more information, you can call the Nebraska Medicine Pain Medicine Clinic. The number is 402-596-4200.